Alors, bonjour tout le monde. Hello, everyone. Good morning, good afternoon, good evening, wherever you are. And welcome to this plenary session of the CSPC. Alors, bienvenue tout le monde à cette conférence plénière, ce panel plénier de la CSPC. I'm joined by my distinguished colleagues from around the world, and I will introduce them to you shortly. But first, I'll say that I'm co-chairing this panel with my good friend and colleague, Rémi Quirion, scientifique en chef du Québec. Donc, on va co-animer ce panel ensemble, Rémi Quirion, scientifique en chef du Québec, et moi-même. Je vais m'occuper de la première partie qui est plus simple, et Rémi va s'occuper de la deuxième partie et de faire donc les remarques de la conclusion. La première partie, c'est les panélistes qui vont procéder à faire comme des genres d'entrevues. Donc, chacun va demander à un autre panéliste une question à propos de la pandémie. Et une fois qu'on a fait le tour des panélistes, bien, on va passer à l'auditoire et à vos questions. So the way we're going to do the first part is actually each one of the panelists will ask another panelist a question, a sort of interview. We'll keep the remarks short. So these will be in lieu of the opening remarks, if you want. And during that time, if you have questions, please put them in the Q&A box. And we're going to keep a lot of time for your questions and hopefully answer them as well. Alors, voilà, on va commencer maintenant qu'on a les règles du jeu. So I'm going to introduce my colleagues here very quickly. I have with me Sir Patrick Vallance, the UK government chief science advisor. I have as well with me Juliet Gerrard, the Prime Minister of New Zealand, chief science advisor. And I have VijayRaghavan, Indian government principal scientist, scientific advisor is the exact word. And we're absolutely delighted to be joined as well by Jean-François Delfraissy from France, who is president of the Comité scientifique COVID-19 du gouvernement français, donc qui font les recommandations directement au président de la République. Et le docteur Delfraissy est également président du comité consultatif national d'éthique en France. So, and of course, like I said, this is, I'm co-joined by Rémi Quirion from Quebec. So before maybe we get started, for those who were at the CSPC plenary panel last year, and those who were not, you're going to learn this now. Patrick and I, we were on a panel, and the topic of the panel was actually harnessing data for science advice in health emergency. So this was in November, and we all know what happened after that. So if today we talk about any reference to any global pandemic, take note, or maybe we shouldn't. But Patrick and I have decided that at the end of our terms, maybe we should start a business of foresight for governments since things worked out so well last year. And by the way, it is Entrepreneurship Week that's starting this week. All right, so now back to more serious things. And I'll start by asking Patrick, no, not for his prediction for 2021, but actually about the UK system for science advice in emergency. And Patrick, you have such a great system for science advice in emergency. It's actually inspired our own work here in Canada. But can you just tell us perhaps how this pandemic or this emergency has been different, or what have you experienced differently for this one versus other emergencies that you've that you and your predecessors have had to manage in the UK?
Yeah, well, I think it goes without saying, and thank you very much for the invitation to be here, but it goes without saying that this emergency is quite unlike anything else. And so, yes, we have got a long-established system for science advice in government that's well structured, well organized, and has been through lots of other emergencies. But when I think back to the 2.5 or so years I've been in post, the emergencies have been short. So I've done one, which was to do with Novichok poisoning of somebody in the UK from Russian poisoning. I've done one which was to do with a dam that was in danger of collapsing, and trying to get some advice around the likely flow of water and so on. And all of those were quite short-lived things. And so most of the previous emergencies have been short-lived. This one, of course, we've had 68 meetings of our formal science advisory system, which is external and internal scientists in government. We've published over 400 papers as a result of that. And we've had to do it in a way that's been quite different from previous emergencies. We've had to play catch up to understand about this virus. We've had to seek permissions to do things we've not done before. We've had more pull for science advice than we've ever had. I mean, ministers desperately want to hear from us. I mean, they don't always like the answer, but they want to hear from us. And so I think that's been quite different from any previous event. And that has put quite a strain on members of the advisory panel. So at least half of the members of our advisory panel are academics who've got other jobs, and those jobs have really disappeared because they've been so ingrained with having to try to get the work going on this that I think it's put pressure on them, it's put pressure on the universities, and everyone's felt it. So the first thing to say is it's completely different because of the time course, because of the speed of response needed, and because of the pull we've had from politicians. The second difference, I'd say, is it's all been done in the public gaze. I mean, it's very, very public. And we've had a lot of media interest, and the media interest is often quite personal and quite direct for people. We've had people on the Science Advisory Committee called SAGE speaking themselves in a personal capacity that gets bound up with what SAGE thinks. We've had a lot of media interest, and that has brought its own pressures. Of course, it's great to be transparent and open and to make sure people see the workings, but it has brought problems, and it has brought pressures on a number of members, which we've had to try to manage and support. The third thing I'd say that's dramatically different is we've had to set up new teams and sub-teams in order to support this. So we've got several hundred scientists that feed into SAGE in different groups. We've got a modeling group, a behavioral science group, an environment and transmission group, a group working on ethnicity, and so on. We've got many different subgroups. And setting those up whilst trying to run the whole process has been a bit like trying to repair an aeroplane whilst flying it. And it's really felt like that all the way along, that we've had to do things that we've never done before. And some of it's worked well and some of it hasn't. And we've had to adjust as we've gone along. And then maybe two other things to pick up. I don't think we've ever had such a need for really, really good data flows. And it's exposed where we haven't had good data flows, where it's been difficult to either access the data, to get permissions to access the data, to integrate data across systems, has not been as straightforward as I think we would have hoped it would be. And I think that's a very big lesson for managing emergencies. And one of the things that I've taken away from this is we need to go back and look at our overall risk register and ask the question, what are the data flows and information sources that we would need in the event of another emergency? Who are the data owners, and how do we know we're going to be able to access them? Because we found it quite difficult. It's in a reasonable place now, but it took quite a long time to get those data flows right. And then my final area that I'd say has been different is it's been very clear that we've got science advice systems in every government department, but not all of them have been able to stand up as effectively with enough critical mass as we would like. And so we've also been trying to build science capability in departments during this to make sure that departments have their own science advice feeding in, because it can't all come centrally into SAGE or into what my team does. So we've been building science capability in other departments. So it's been quite unlike any other emergency that I've been involved with or any of my predecessors have been involved with.
Thank you so much, Patrick. And again, I'm just like, so grateful to you and your office for, all the support that you've provided me in the past years that actually allowed me to respond to this emergency by putting in place the committees, by not having any blind spots anyway. It's all thanks to you. I guess my very short follow-up question to you is, and you mentioned it already in the various departments, the science advice. Perhaps if you could just, tell us how did you sort out what, for example, your office had to do versus what, say, the chief medical officer or the public health agency had to do in this public health emergency?
Yes, and I'll start by echoing your point about the support that other colleagues have given. I mean, what's been noticeable about this is how important it's been to speak to colleagues from other countries, and we've learned a lot from each other. So I was very fortunate in some ways in that the chief medical officer in the UK happens to be somebody that I've worked with a lot in the past, and we worked together actually when we were doctors a number of years ago in working in the same hospital. So we know each other well, and it's therefore been relatively easy to work out who's doing what. And of course, this is primarily a public health crisis, so he's got an awful lot to take on. We've co-chaired the SAGE committee. I've taken on the day-to-day running of that because he's got other things to do in health. And I think in general, we have been absolutely aligned on all aspects of this, and we speak many times every day. And I can't imagine what it would be like if we didn't have that sort of relationship, because this is difficult. It's difficult enough for everyone, but to do it on your own or to feel that you hadn't got alignment with your medical colleagues on this would make it almost impossible, I think. How do we formally divide up duties? Well, it normally comes about if it's obviously fully health, so it's something that's about operational delivery in the health service, I don't get involved at all. If it's something which has a public health angle, but it's science and it crosses other boundaries, then it will come into SAGE. So things like, how do we think about schools? How do we think about transmission amongst young people? How do we think about environments in which transmission takes place? That would all come through SAGE. Anything that's pure health would stay in health. But Chris and I, Chris is the chief medical officer, we speak several times a day, and if any doubt, we work it out quickly verbally, and I'm sure that's the right way to do it rather than have hard and fast rules.
Well, thank you very much. That's already extremely helpful. So now I'm turning it to you to ask your questions.
Yes, thank you. Well, so great to be able to ask Rémi a question, actually. And Rémi, you clearly act as a science advisor in Quebec, and Mona has other responsibilities across Canada. I'm just interested to know, in your system, what about the similarities and differences between the advice in the different areas? And indeed, as you think about municipal, regional and federal levels, was there different advice happening at different levels? And what is there that can be learned from that? I'd be quite interested in your experience.
Oui, merci beaucoup, Patrick. Je suis probablement là, le plus vieux en termes de temps comme aviseur scientifique, là, 9 ans, so almost 9 years. I'm in the job, of course, very, very different than during this pandemic. And what you mentioned, Patrick, with the colleague that you have in the UK, well, Mona and I also have known each other for many years. So that helped a lot when you know people, and we were working together before the pandemic on various dossiers. But of course, during the pandemic, since the beginning, we worked very, very closely together. The system is kind of complicated in Canada because health and education are provincial matters. So it's like we say we have one healthcare system in Canada. In reality, we have more like a difference between various provinces. So we have 10 or 12 of these healthcare systems. So it's certainly a challenge when you have situation like the pandemic. But I think that's why also Mona and I work very, very closely together, saying maybe yes, at the end of the day, health in Quebec is the Minister of Health or Public Health Agency, but exchanging data, exchanging information that Mona had gathered at the national level were extremely helpful for us here in Quebec. And of course, as you said also, Patrick, science is on the public place every day. So a lot of scrutiny, what we do from a newspaper, from journalists, from the general public. So we cannot make too many mistakes. So by being able to say, yes, it's not just us in Quebec that are going in that direction. We also compare data at the federal level, but also globally, the rest of the world. So I think that helped me a lot. The major difference, one of the major differences is that Quebec, of course, is much smaller than Canada. In the end, as I said, health matter and care matter. It's local. It's the province of Quebec. So probably I'm a bit closer to the decision in the end of the day, because the decision is made by the Minister of Health or is made by Public Health. But we have done a lot of things together. So to say that's what we are trying to do here in Quebec. Can it be helpful for the rest of Canada via Mona's office, or the other way around? What Canada is doing, can it help us here in Quebec? For example, we started early on, started a biobank in Quebec, discussed very early with Mona, expanded that at the national level, and that was extremely, extremely useful. Mona's group, many other, like mask, we talk a little bit about mask, what the advice that were coming from the federal level, can we apply that at the level of Quebec? And there the challenge for me was to convince my colleague in public health that yes, data coming from the federal level, coming from scientists, different type of expertise is good as well, because sometimes, and I don't know if others have seen that, but we've seen a little bit of competition between, I would say, public health agency and other group of advisors in Quebec, like myself. So being able to talk to Mona and the group in Ottawa very frequently, we're able to exchange on best practice and also on things that we did not like. So we are able to say for 10, 15 minutes, oh, we were not so happy about this. So after that, we went on to something more positive. And I think that was extremely, extremely helpful. At the end of the day, for things like healthcare, of course, cities have a critical role. That's the citizen, the mayor of cities or municipalities are closer than the federal government, than the provincial government. So we started to work much more closely with cities in Quebec, and having kind of link that we have as well with the provincial government. So having advisor to cities. And I think that will be, if there is one good thing from that pandemic, is that we will get much closer to the ground, in a sense, to the citizen that suffer because of the pandemic. And now my hope, and maybe a challenge as well, is to say that we demonstrated that we can be fairly agile and be very proactive during the pandemic. How can we use that type of strategy for other global challenge like climate change? How can you bring climate change close to the citizen? What's the impact on my street in the city of Montreal? Then use that a little bit, what we learned from the pandemic, use that in future also to make sure that decision at the municipal level, at the city level, are based on data. To end, I say that data, you mentioned data, Patrick, There's still one of my main challenges, I would say, access to data in real time. There in Quebec, we are behind. I say that in Canada, I don't know if Mona would agree, but in Canada, my best example there would be British Columbia, where you have much more direct access to data. In Quebec, it's still very challenging, and you need to, there are a lot of delays, so that at the end, the data are not as useful as it could have been, because it's a bit too late when we have access to them.
Yeah, that's very interesting. Can I just ask one quick follow-up, which is, so that observation of getting closer to the cities and closer to where things are really happening, which I think many of us have observed, how do you think you can make sure that is captured and you do that going forward when you're tackling other problems? What needs to happen to make that work?
What we have started to do, and probably it could be different recipe in different places, but in the city of Montreal, for example, now there's a group of science advisors to the mayor, so a bit the model that you have, but at the level of the cities. These guys are very strongly associated with us. So we have a lot of events that we organize together. So again, we know each other, and they work really very close to the mayor's office. So that basically they can say, yes, we have a flooding based on science. That's what we should do. But it's still early days. So it's still something that we are building, and we have a session at CSPC on Friday with the mayor of the city of Montreal and others to say, well, how can we build that a bit stronger at the municipal level in terms of science advice and basing your decision on science. And
yeah. That's right. I would be very interested, to hear your experience on that, because I think that's going to be something that's relevant to all of us and really an important thing going forward. I think now I turn over to you, Rémi, to question Jean-François.
Oui, thank you very much. Bonjour, Jean-François. Question in English, but if you prefer to answer in French, there's no problem at all, of course. In France, and it's not necessarily surprising, many experts made statement in the media on COVID-19, commented on specific scientific result, commented on the politics from the French government, very, very present in the public space. How did that impact your work as president of the advisory council?
Good question. I have no clear response to that, but clearly it was a problem for us. Perhaps to give you some information about the French Scientific Committee, it's quite different from UK. It was a new one because it's not the same organization that you have in UK or in Canada, for example. I'm coming from the research area. I've been in charge of the INRS, the French National Agency on AIDS Research and viral hepatitis, and I was in charge of the French Ebola response 5 years ago with Guinea. The French National Committee was created by President Macron at the beginning of March, and after a meeting of scientists that I have organized at the Élysée Palace, and because I was coming from the meeting at the WHO in Geneva in mid-February, and I say there is something which is not really clear for France, and I try to inform and to give also some alert to the President de la République. So we are 12 scientists coming from different multidisciplinary approach, and with epidemiologists, virologists, intensive care unit, and also from 2 scientists on human and social science, because since the beginning we think that human and social science are science, and also that it will be a major issue for the public health response given to French citizens. After that, to respond more clearly to your question, yes, we have a problem with the relationship between French scientists and media. The first big problem was about Didier Raoult and hydroxychloroquine. As you know, Didier, and probably a lot of you know Didier Raoult, and me too, since 20 years, and clearly it was a great scientist. After that, he decided at the beginning of February to say that he had the drugs for COVID-19, and it was impossible with a lot of discussion. I know Didier since a lot of time, but it was impossible to discuss and to say you have to good research and a good implementation of your clinical trial. So it was really a problem in March, in April, and in May, because the scientific committee decided to don't take any opinion about these drugs and the other drugs, but we wait to have the results of a clinical trial coming from WHO in CERM in France and in UK too. So we have only an opinion at the beginning on that part, only at the beginning of July, when we have all the results of the three big clinical trials. After that, it was very difficult to comment about this during April and May with the results of Marseille. And it's not only in France, but it was a global issue, I think, for the global scientific community in infectious disease. Perhaps I want to say also that we have in the relationship between the scientific committee and the French government, I can say three points. The first one is about timing. Time is 2 hours for media, 1 or 2 days for politicians, and many weeks or months for scientists. And I say to the President of the Republic that it will be difficult to have good results and good science, and that we have to wait in weeks, and that we have to wait probably many months before to obtain results in innovative and in therapeutics, but not only in therapeutics, but also for different points. And that's the first issue, because politicians want, and I perfectly understood, want to have response in 1 or 2 days. And for me and the scientific committee, we say no, it's not possible to, and we need to have good science. The second point is about what I call, and sorry for my English, but I think that you understand what I want to say about doubt. And because clearly doubt is a major issue for science. And if we have no doubt, we are not a good scientific. And you have to obtain results and to see the results, to discuss results, and to have a global view about, and a global discussion about and doubt about some results. And clearly for the politician is clearly difficult to understand, because they say you are a scientific committee, you have to know what we have you have to know what we want to, what we have to do. And clearly it was not possible with this new virus, and it was very difficult, because we obtained, as in other countries, a lot of results during the months and during the April, May and June, but not before. And clearly in the French culture, and for the French high level of politicians, most of them, and it's quite, for example, I think it's quite different in UK and in Germany, they are not PhD. So they don't know what really happens in the building of science, and the discussion between scientists and politicians at this high level is something difficult. For example, when you present to the President of the Republic and you say that curve of new cases in COVID-19 is not geometric, but is logarithmic, and you have to say and to try to that the president knows what is the difference, and to say the curve, and clearly that's a good curve at the beginning is not a good curve at the end, because it's logarithmic and it's quite different and exponential. So it's quite different from a geometric curve. You know, the question and the discussion is a lot of interest, but sometimes difficult. Finally, if I look in the relationship between our committee, which was clearly independent because it was created for this situation. The situation is quite different what you have in UK, but I am thinking for the future of a new model for France probably. And clearly in most cases, the French authorities accept our recommendation, except one, and it's a big one. We say that at the end of July and at the beginning of September, that a second wave will be very active in Europe, and particularly in France. And we have a different meeting, and I try to explain and to give the reason why a second wave will occur. And finally, the high politician take a decision only on mid-October. But you know, I perfectly understand it's really difficult because the decision is not only on sanitary decision and but also on the economical decision, and also to what in what condition the French citizen can accept a new and a second lockdown. But clearly, between mid-September, between the beginning of September and the end of September, the French Scientific Committee says that we have an emergency with the second wave, and the politicians decide only at the end of September.
Thank you very much. Maybe a quick follow-up question in terms of lesson learned or way of doing things. Do you think that eventually France should have a chief scientist, or chiefs follow a chief scientist model?
You know, that's a real question at that time. And we for a lot of reasons, and we have only a committee which name is OPEX, which is not a committee for the President de la République, but for Assemblée Nationale and Senate. And it's the composition of this committee is with senators and members of the National Assembly and scientists. So it's a mix of different population. But we have no in France a chief scientist as in UK or in Canada. And clearly, this is a question for me to begin to have lessons from the crisis. And we have a Directeur Général de la Santé, and it was as described in UK. It was a friend of mine, so the relationship was very good because we have been in the same hospital during the 10 years period. So the relationship was very good. After that, I think that we have to think about, I don't know if it is a chief medical officer or a committee for research. You know, that's my question at that time. But I have the question on the table, I know.
Very good, thank you very much. So, maintenant, votre question pour Vijay.
My question is about on the fact that in all countries, most of our decision or decision of a politician, because it's decision of politician and not of a scientific committee, were in the public health era. and innovative drugs or products are not at that time at the rendezvous. We have no really drugs against the virus itself. We have drugs for very les formes graves. After that, since 1 week, we have two announcements about vaccine, and with very positive results. After that, it's very short, with a very short issue. So what do you think during the next 6 months? How do you discuss the balance between what we have to do with the public health response, and I think it's clearly very, very important at that time too, and also the organization to delivering new vaccine for a specific population.
Thank you very, very much, Jean-François. This is a very important question, because the way we have gone through the pandemic, people, first of all, were shaken by the new viral disease and what to do. And then we embarked on a scientific enterprise to solve the problem by searching for drugs, for therapeutics and vaccines. Meanwhile, people were told that non-pharmaceutical interventions such as masks, physical distancing, hygiene could crunch the spread of the virus. Now and they've also been told that vaccines afford an escape from this pandemic. But as the vaccines come in, there are going to be enormous challenges in stockpiling, fill and finish, and delivery, not to mention the costs of the vaccine. In that period, there is a danger that public attention to non-pharmaceutical interventions will go down. So what I think we need to do are 3 things. First, communicate the importance, even in this situation, as vaccines are coming, to take care, both in terms of our non-pharmaceutical interventions, but also combining testing and tracing as we go on into our jobs or to our workplaces, which have started opening up. So testing, tracing, and isolation are critically important. New tests are coming in, which allow this to happen with greater and greater speed. And this will allow a better understanding of disease prevalence also, which is going to be important as we go into vaccination. So that's one important aspect. The second challenge is the IT back end for vaccine manufacturing, stockpiling, barcoding, delivery, and also for vaccination. There are going to be many, many different kinds of vaccines in the market. There are going to be many vaccines which come in through organizations such as COVAX, in India through a national immunization program. These would be free or at low cost. Other vaccines people will pay for. How do you know who has got which vaccine and which second vaccine to get? India is putting in place a massive IT backend to allow this to happen, because for the first time, we're going to have an immunization program which goes across the country simultaneously in waves to healthcare workers, those who are most needy, then to others, as opposed to earlier programs which started region by region and went by. So all of this will simultaneously require, again, the putting in place or the continuing of non-pharmaceutical interventions while the vaccination program goes in. Thank you.
Thank you, and I fully agree with this delicate balance that we have to do during the next 6 months. After that, I think also that the fact that we can think about a vaccine, because clearly we are not sure at that time that we of really the capacity to obtain a large amount of lots of vaccine for all countries, and clearly this is a major challenge for the next months. But the idea, not only for scientists but also for citizens, that perhaps it will be possible to have a vaccine is also I think a major issue. Yeah.
Well, thank you, Jean-François. Let me just add to that. India is one of the world's largest vaccine manufacturers, and 2 of 3 vaccines which children get in the UNICEF program are made in India. So there's an enormous capacity, and Indian vaccine companies are partnering as well as developing vaccines so that manufacturing is not in short supply. So that's, I think, a good sign of where we're going. So the early stages will be tough. Vaccine availability will be low as we start, but as they get ramped up, the distribution challenges will come by, but I think there are good solutions to that available. So thank you. I will now, Jean-François, go on and ask Juliet a question. Juliet, we've all the world over been very impressed by the way New Zealand has handled the situation. And there's no doubt that you need to put in a lot of effort to get it right. There have been comments that this is feasible because you're a group of islands, and therefore you can clamp down on those coming in. But that said, once there are cases inside, they will also spread, and there were cases. So what would you say are the most important factors contributing to New Zealand's success?
Thank you, Vijay. I'll list a few, and many of them resonate with some of the comments that other people have made, but we had a different trajectory in terms of timing and luck in some ways. So first of all, the virus didn't reach our shores until it had reached several other countries. So we were able to observe very clearly what was going on overseas and what wasn't working overseas. And I'm hugely grateful to the chief science advisors internationally for sharing those experiences right from January so that we could really pick up and learn. But as you say, we did have several hundred imported cases. So luck only took us so far. I think the second point I'd make is there was good leadership right from the top. So we were fortunate to have a prime minister that from the very beginning wanted the evidence, was very tenacious about understanding everything that the scientific community knew about the virus. And she was prepared to make bold calls early on. So she's a good communicator and came up with the strategy of going hard and going early to really conquer the virus before it took a hold. We also had brilliant leadership from our Director General of Health, Ashley Bloomfield. It's quite interesting in terms of a trust in science perspective that he's now something of a celebrity. He's had to step off the TV Personality of the Year shortlist because it's inappropriate, and people have Ashley Bloomfield t-shirts and earrings. It's a very different look from how it is in some other countries, and that's a testament to his commitment to every day at 1 o'clock turn up and front the media and explain what was going on, what our numbers were. So all up, we've had only 2,000 cases and 25 deaths all year. The scientists themselves played a role. We're a very small community. I don't think we ever fooled ourselves that we were particularly prepared, but that meant we were really prepared to connect internationally and learn as much as we possibly could and scramble. So we didn't have the formal structures, but we did have good relationships, both within the country and overseas. And one scientist in particular, Michael Baker, was an early and good, strong advocate of an elimination strategy, which is quite easy to communicate, actually. It means you have zero tolerance for cases. And that was a strategy we adopted, having pivoted from the plan that was in the cupboard. And we had a pandemic plan finished in 2017, but that was designed for flu. And clearly the people with flu plans weren't working. The people with SARS plans were having more luck. And we captured that as a simple statement that we were moving to an elimination strategy, so zero tolerance. And that made the policy decisions brave but clear. So we shut down the country completely in a very strict lockdown after having closed the border to everyone except returning New Zealanders who go through various forms of quarantine at different stages in the response. So I guess the lessons there are using our luck, excellent leadership and great science. I'll echo what Sir Patrick said about not being lonely. There was a very strong Chief Science Advisor for Health in town. He was there to support Ashley Bloomfield, but we were in constant contact. His wife was slightly grumpy, I think, that his phone automatically dialed me ahead of her. We were just in constant communication. And I think in a crisis situation where the calls are very big, having good sounding boards is excellent. And that leads, I guess, to communication. So the communication from the PM, from the Director General, from the scientists, and even from the media was very clear and pretty much aligned. So I've been reflecting a little on the doubt in science and how that should play out publicly. If anything, I would say, especially during those critical early calls, everyone was too lined up, if anything, but that was very helpful for getting the public on side. So the public heard from the expert scientists, the Prime Minister, the Director General of Health, and the media of the importance of taking these really drastic measures. Well, they seemed drastic at that time. They don't seem drastic now, but we were early adopters of some of those border shuttings and lockdowns. And finally, the systems that we have worked well for small numbers. So picking up on the commentary about data flow, I think we would have struggled had we had more cases for some of our methods to scale. We like everybody else, were building a system while the aeroplane was flying. We've ended up for our second small wave of around 100 or so cases, sequencing every case and using that to guide contact tracing. That's simply not possible on a larger scale. So we've used our luck well. We weren't challenged to scale because we made those early calls. Why was it successful? A lot of the factors that I've talked about, but the thing I've missed out in that commentary is relationships. And I think being a small country, we only have 5 million people. It tends to lend itself to loose, informal structures. So the PM would text me, call me very regularly during those calls, just to cross-check the formal advice that was coming from the Director General. There was an acknowledgement that we were underprepared for a pandemic and prepared to change and prepared to act. And again, relationships, we were very well connected overseas. So I think those are probably the main things.
Well, thank you very much. That's really fascinating. I think we're out of time, Juliet, so I must hand over to you to go back to Mona now.
Okay, Mona, you opened the session by discussing how science advice should be done in a public health emergency, and we've now all been stress tested on that topic. Have you, in your experience providing advice on the pandemic at the federal level, identified any gaps in science advice that we could address and be ready for the next health emergency?
Yes, many. You know, it's been fascinating because, of course, when the pandemic started, my office had been up and running for barely 2 years. I had been, you know, sensitized to the importance of science advice in emergency. So I had looked at the possibilities. We did a trilateral exercise actually in June of 2019, seems like ages ago now, with the UK and the US. And after that, of course, we had an election in Canada, and when the new government came, like I was getting ready to, you know, make actually the advice to how we can enhance science advice for emergency when we had to start working, you know, as we just like as the emergency was unfolding. So we didn't have things like, for example, a list of experts for the various risks in the risk registry. So we had to, you know, go very quickly to do this. getting a lot of people, you know, with secrecy clearance and other things. So I think that moving forward, because you never know, right, where it's going to hit you from, we have to do this. And the important thing also that, again, my good colleagues in the UK had warned us is it may start as a health emergency, but it's not only a health emergency. And when things started in Canada, you know, the health ministry, of course, thought they had everything under control because it's a health emergency. And number one, they you know had to deal with things like the H1N1 pandemic, the SARS, which gave rise to the Public Health Agency of Canada. So they've managed these things without a chief science advisor. Of course, they weren't of the same magnitude or anything like that. So we had to learn to work with each other, to be, you know, very candid about it, and understand, you know, who should be doing what and when. The other thing, as you heard from Rémi, Canada is a great federation, but health is actually a provincial jurisdiction. And you know, but now we didn't have time really for it's my turf or your turf, or my responsibility and your responsibility. And I think that in general, you know, Canadians were very pleased, and myself as a citizen, I was really happy to see the different level of governments working together. But in terms of science advice, that also created some challenges, because unfortunately we don't have a chief scientist in all provinces like there is in Quebec. So for me, it was easy to turn to Rémi to coordinate a little bit what's happening in Quebec and for the rest of the country. But with other provinces, it wasn't as obvious. Other provinces put together at times some science advisory groups. Thankfully, some of the members there were also member of my science advisory on COVID-19. So we didn't have a lot of disagreements. Now, you know, what the politicians decided to do with the science advice is another story. But I think if we had a, you know, a network of provincial, you know, regional, local, and federal science advisors, I think it would have made things maybe a little bit easier in terms of communication and in terms of, you know, agility and implementation of different measures. I think the last thing I will say is, in terms of the science advice, and other than, you know, the obvious coordination issues between ministries and between regions and so on, but I think that we had the public. It's really important that the public actually accepts the science advice, and of course, you know, any measures that come from the science advice. And it was the first time, I think, for all of us that we were, you know, governments were actually enacting policies in real time based on the science. And that created challenges, of course, in terms of public understanding of the scientific method, I would say. And I think Jean-François, you know, alluded to this. The fact that scientists and experts disagreed sur la place publique, you know, about certain interpretations or certain measures, somehow maybe, you know, gave the public certainly, you know, enhance the infomedic and the sort of conspiracy theorists and other, you know, fake news and stuff like this. So I think moving forward and in preparation for the next emergency, whether health or anything else, I think, you know, enhancing science literacy in the public, certainly in Canada, but I would say globally, given how quickly, you know, information travels these days, is maybe something that is might be an interesting project for, you know, the International Science Advisory Group to tackle together.
Thank you. I'm really interested in the relationship with public health advice. So I think that's been mentioned by a few of us. And in the case of the UK and New Zealand, we had really good personal relationships between the people advising in those departments. I wonder if you've got any reflections on whether we need a structural solution for that, or whether it's simply relationship based. So, for example, we had a measles outbreak before we had COVID-19, and that wasn't something where the science advisory system got particularly involved because it was a straightforward public health response. But this one was different, but we definitely felt some of those tensions. We just managed them with the relationship. It's a good tension in some ways. But have you got any thoughts about how countries might manage that to best effect?
Well, I'm going to start by saying that I was fortunate that that the Deputy Minister of Health, or the Permanent Secretary of Health, I guess, in the UK system, maybe in New Zealand, I had worked with him before. He's a scientist who was Deputy Minister at Environment. So that was, already quite helpful in that sense, that we had already worked together. I knew that the Chief Public Health Officer, but I really, had only, courteous couple of meetings and calls with her, again, because, it's my office was new, I was new in the job, and so on. Personally, I like to keep things very agile and so on. But I would say that it's dangerous to rely only on the person to person and goodwill, although people in the end make or break the best or the worst system. But I think some clarity in terms of the relationship between the chief science advisor and, say, the public health agency, and in other cases, if we have a nuclear incident, or if we have an environmental incidents, it's going to be another department. So I think having some more structure there, and perhaps others who have more experience than me could weigh in, but I think would be good without keeping it too rigid, so that we can work as science requires and as the situation also requires.
Thank you.
I think now we're ready for the question from the audience. And I think all of you should feel free to provide some answer. Maybe I'll start. There is quite a few, many questions, but I'll start with one related to vaccine. Vaccine distribution question. Well, okay, each country trying to make sure that they have enough doses for their citizens, but is it the best strategy? So how to make it more global and open? The technology or the approach used to develop vaccine are very different from one, which is probably good, but some of them are very new, never been tested before clinically to provide really a successful vaccine. Are you concerned a little bit about that? And then vaccine hesitancy, fake news, all that. People start to say, well, I don't want a vaccine. So yes, a big question about vaccine, but we are right into it. So what kind of comment from any one of you? So maybe start with Patrick.
Yeah, I'm happy to start. So I think on the question of vaccine distribution, I mean, it seems to me so obvious. This is a pandemic. So the solution is not going to be to have a country vaccinated. It's going to be to have the world vaccinated to be part of this. And therefore, you have to come up with solutions that allow a worldwide approach to this. And we will end up in a big mess, I think, if we end up with lots of countries that can't vaccinate. So I think systems like COVAX and some of the other things that have been mentioned are incredibly important. And although most countries, and the UK has certainly done this, have hedged their bets and put bets on a number of different vaccines, if they all come off, we end up with a massive oversupply. And it's really important that oversupply is used in the right way. And it's also important, I think, to recognize that, and this goes to the second question in a way, we don't know about the long-term safety yet. So it's incredibly exciting and incredibly important that we've had 2 messenger RNA vaccines that have read out positive. And it's very likely, it seems to me, because the immune response has been pretty good with most of the vaccines that have been tried, that we will end up with lots of vaccines that work, and we will have different technologies. And that's a really important step. We now know that you can make a vaccine. So that raises the question of which vaccine for which parts of the population. And I agree with the premise of the question, which was essentially, we don't know about the long-term safety profile of the new technologies. Would you use them across the whole population? And I think that's a big question that people are trying to grapple with now. You'd certainly, I think, want to try and make sure that the people who are elderly, vulnerable, at high risk, maybe with a 10% mortality risk from COVID, are the people who would take whichever vaccine comes first, because their benefit risk is going to be huge from that. But if I'm a very healthy 20-year-old, it's a different story. I want to make sure that I understand the risk benefit for the vaccine. And that, I think, is the work that we've all got to do over the next few weeks and months as vaccines read out. How do we think about the different vaccines for different populations, and how do we make sure that that's done properly and safely? And what sort of pharmacovigilance system must we have in place worldwide to understand the effects of this, both the efficacy and the safety signal? So I think that's the next really big challenge in this field. And I think that also speaks to the third question about vaccine hesitancy. I think there will always be people who are skeptics, but I think there are many more who are not. And I think that what we need to do is to make sure that the information is clearly articulated, the uncertainty is acknowledged, and the reason for a vaccine strategy following a certain prioritization is clear to people. Because if we don't do that, we will lose public trust and lose public support. But I think those are the big challenges that we face now. But it's a good challenge to have. And I was saying to Mona at the beginning of this, I mean, the extraordinary results of the vaccine so far are the first serious glimmer of light at the end of the tunnel.
So it's very important to keep public trust. Anyone else? Mona, Juliet, Jean-François, Vijay. Vijay, you said that India produced a lot of vaccine. So what's your take on that one?
Well, the big issue of vaccine nationalism needs to be addressed. And as Patrick rightly said, this is a pandemic, and therefore the entire globe needs to be protected. And therefore, we should come together to combine the manufacturing strengths of countries such as India, enable that manufacturing strength in new technologies also, and partner so that distribution can be worldwide, both to rich countries and low and middle income countries. This is very important. There is a great danger that the getting together, which we see today, should not go away and should stay on as preparedness for the next pandemic or the next challenge. And therefore, it's important that we put these collaborative principles in place right now. And of course, safety is very important, and we will know that as we roll vaccines out. Post-marketing, surveillance is very important, and all those issues will come up. But it's really very good to see these vaccines come out, and I think more will be coming soon.
Any other comment on that one?
Yes, perhaps Jean-François. Clearly, I think that it's the first good novel, and I fully agree with what has been discussed before. We need some data on not only on side effect, and I fully agree with side effect, but also on long-term protection, because we have only data on after two injection and 1 week ago after. So it's very short. It's a new technology. The first time that we have such results with mRNA vaccine. Finally, we know that after COVID-19 infection, some people, and a large fraction of people, decrease their antibody level after 6 months. So we don't know what will happen with vaccine, and we can anticipate that we have a very, I think, and good protection for the first month, and after we have to see what we be able to, and probably we can also imagine that it will be necessary to have a second shot of vaccine with a different vaccine 6 months after, etc., etc. So I think clearly it's the beginning of a new story. For the side effect, I fully agree, and clearly the benefit risk is a major issue. I think that we all agree that all people and priority group. After that, when for nurses and physicians, etc., which generally is considered as a second or the first priority, we have to discuss to vaccine, for example, a nurse 25 years old, and we don't know what will happen with the side effects. And we can consider that side effect will occur with such a kind of vaccine. It's a general issue with all vaccine, and I consider that it's a benefit risk positive for all people, but for young nurses, we have to discuss about that. And finally, our President Macron says that vaccine is a bien public mondial, and I think also we fully agree with that. We have to remember that we have for me, I have exactly the same discussion 25 years ago with generics with HIV drugs, and some people say, you know, it would be impossible to treat everybody, and now we have done it. So I think that we have this good example. We have also a good example with not so good, but good also with treatment for hepatitis C. So I think that clearly is a great challenge, because as I said before, you know, it's not only a vaccine for northern country, but it's a vaccine for all the world, because in other cases, the pandemic will come back.
Juliet and Mona on that one, or yeah, Juliet?
Yeah, I'm really interested in how we as a scientific community communicate that risk. So we don't have the long-term safety data, but that risk-benefit equation for different demographics is going to be really hard to communicate, staying honest and clear without fueling the anti-vax movement. So that could be a nice piece of work for the chief science advisors to think about how to get the message across, why you would give it to your grandmother but not your sister.
That's very, very critical. Mona?
Well, you know, I'm just going to add a couple of things. First, I'm really proud that Canada is a proud member of COVAX. We have contributed, and we even said that, you know, the vaccines that we have made advanced purchase agreement for, if all of them pan out, we may not need them all in Canada. We'll probably won't need them all in Canada, and we are going to donate them to the rest of the world. So I think this is something that's important. The thing, you know, I of course agree with everything that's been said. I would just like to add that, you know, there is a sort of practical and ethical question that's in front of us in terms of the vaccine distribution and who gets, you know, what when. But let's also remember that we have a scientific and research question in front of us, and that you know, there's just still so much that need to be learned about the immunity to SARS-CoV-2, and as we vaccinate people and as we you know, still have infections ongoing, I think that you know, human-based studies and cohorts are extremely important to help us navigate this and determine whether we're going to have to, you know, perhaps include this vaccine as part of the, you know, flu shot that we get every year or not. So I think that there's still a lot of scientific and research collaborations that are needed as well to understand the immunity.
Very good. And I fully agree with that, with the last part. And maybe another question from the audience, a bit difficult. What about the concept of One Health? Yes, human health, but also animal health, and the outbreak in the two groups, and intensification of research program globally on that front. Who would like to take a stab at that? Vijay.
This is such an important question because, there's a mindset which is partly right, that close human-animal contact in wet markets and such places are the causes of spillover. That's partly right. Spillover comes, zoonotic diseases come from that, but also from relatively mundane environments. A big garbage dump in cities can be a source of spillover. Urban areas where deforestation has taken place can upset the balance and allow organisms to find new hosts which they didn't have earlier. There's an example which I really like in Kazakhstan. The Saiga antelope has a commensal bacterium in its nasal passages, and an increase in temperature one summer made those bacteria invade the bloodstream and cause sepsis. So climate change can affect organisms living within animals and cause them to have impact. So I think there's an enormous room for public health research, which brings in all kinds of people, mathematical modelers, biologists, environmentalists, ecologists, to look at these questions in new ways, because we don't know what will happen and where it will happen. So great room for investing in basic interdisciplinary sciences.
Very good. Anyone else want to add to that?
Yeah, I'll come in as well, if I may. I mean, I think Vijay is exactly right. I think this is an incredibly important question. And as we think about recovery from this pandemic and what needs to happen, I think focus on zoonotic diseases is one of those things that we need to think about. How are we going to think about them, prevent them, think about the multiple ways in which our treatment of the environment and other areas can actually impact upon it. And it's all aspects, and the one that's come to light very recently is, of course, the transmission of coronavirus in mink, and the fact that we've got these spread through mink leading to reinfection of humans and human to human spread in Denmark and maybe elsewhere as well. It tells us that for just even on the narrow question of this pandemic, there are going to be animal reservoirs that we need to worry about and think about. And I gave this analogy on a call the other day. It's not the wild mink, it's the fact that we effectively put mink into the equivalent of a perpetual nightclub where they can't socially distance in any way whatsoever. That we're going to get spread in those sorts of situations, and we need to think quite hard how we're going to deal with that sort of risk.
A very good point. Any other comments on that one? I think also certainly here in Canada, with climate change and what we see in the north, in the Arctic area. So that's something we have to be concerned about as well, because new bacteria that we didn't know much about now are becoming the forefront. It's a meeting on science advice. So with the pandemic, do we need new model in terms of science advice at the local level, at the national level, globally? Organizations like WHO and others, UNESCO. What's your take on that? Maybe we start with Juliet.
I think New Zealand's probably too small to break it up into regional levels, but we have been trying to reach down to local councils. And so we have quite a strong Chief Science Advisor network across government departments that was built by my predecessor, Peter Glackman, and I've added to. And we have explored ways to maybe get a representative from regional councils to connect with that group. But the tagline for much of our response was a team of 5 million. And I think that was a strength. Trying to break it up into smaller parts wouldn't work in our context.
Good. Mona, Jean-François, Mona?
Well, I think that the meetings of the international meetings of the science advisors, like Juliet said, were very helpful. And just a reminder that it's the international science advisors who actually issued a request to the publishers of scientific journal to have COVID data and science openly accessible. And imagine, I mean, we take it now for granted, and I think it's been a great, development that's gonna help with other things. I think that the connections in a country like, Canada, certainly with the regions, with the provinces would really be great. I mean, at the beginning, like even in Quebec, Rémi, as you know, like the pandemic was mostly thought to be a large city problem. And then, of course, in the second, wave or surge, we're seeing, rural areas, distant area that were absolutely, totally unaffected in the first wave that are now being hit, and they don't have the infrastructure, they don't have the know-how, they don't have access, to enough science advice and public health advice. So I think that ensuring that the connectivity nationally and internationally is something that's extremely important. Now, of course, le pendant de la médaille is we don't want something that is so bureaucratic and heavy and so on. It needs to remain nimble and agile. So I think that's the challenge.
Absolutely, very agile is very, very important. Other
Yeah,
comment?
just a comment. I fully agree that large cities is a major issue for the this COVID-19 pandemic. And it's also true in most majority of big cities in Europe. After that is not, we don't understand some problems, because big cities in Africa, for example, except in South Africa, are not at that time. And I think that we have data now on the epidemiological data, and the problem of big cities in West Africa and in East Africa is not so high that we have observed in Europe, for example. So I don't understand why, and I think this is really a question. We don't know if a third wave will occur in Africa. I don't know, but because the herd immunity is probably and we know that is very low. But big cities not only the response to our question. For the collaboration between the different countries, it is interesting to note that at the European level, we try to, and with UK, with Netherlands, with Spain, with Italy, to have a good relationship, but it's clearly it's only since this summer, and I think that you will agree with that, because in the first 3 months, it was each country tried to give responses to at the national level. So I think that we need more collaboration, and I fully supportive for that, and also that important progress can go on. Yeah.
Yep. Thanks, François. Maybe one question also about youth. I think Mona now has a youth group, young people advising her in some fashion. I have that also for quite a few years in Quebec, and these young ones are extremely dynamic. How to include the youth perspective a bit more in what's on the way, what's going on with the pandemic, or maybe in your country you have that as well. Maybe start with Vijay.
Yeah, I think there's nothing as invigorating as getting feedback, critical feedback from the public and young members of the public in particular. So what we do is broadly three different things. One is my colleagues and I are active on social media, and we try to reply to comments and questions as much as possible. The second is we have a Prime Minister's Science, Technology and Innovation Advisory Council. And at those meetings, we get in expert inputs from mid-level scientists who are not members of the council to come and give talks from others in different areas and different topics. And thirdly, when we're talking about specific issues, particularly now during the pandemic, we have many meetings of, for example, our vaccine R&D committee, where we get different people who are actually involved in the research to make their presentations. So these are, in my opinion, keep you on the straight and narrow and prevent you from thinking about that you have the solutions without getting all the feedback needed.
Thank you. Juliet, on the youth.
I have a question for the Canadians. Was the Youth Council used during the pandemic? We're thinking about setting one up, but so I wonder if they actively fed in at all.
So, Mona.
Rémi, I didn't mean to cut you off. If you wanted to speak first about your Youth Council, okay. So I put together the Youth Council. I think by the time they were set up, it was February. And so they just like started in the pandemic, and the first meeting that we had, they had actually a lot of input and questions about because by that time many of them were no longer pursuing their studies. Some of them had applied actually to go to university and were very anxious as to what's going to happen, whether they're going to be able to make it, and so on. So, bottom line is they provided us with a perspective as to what's happening with them that honestly, in the midst of us trying to just like implement public health measures, we had not thought about. And that fed actually directly into many of the programs that the government after that, put out for both for researchers and also for students during the summer month. By the way, they have a panel at my youth council have a panel at the CSPC council to discuss the youth perspective. What they've also done is they did a survey for graduate students and postdocs to see how they have been affected by the pandemic. They're getting involved. We're looking at reviewing and harmonizing the fellowships and the scholarships at the federal level between different fields, and I actually received a request from the granting council to include members of the youth council in that on that panel. They've been very much involved into the looking at the racial question in STEM. And also at the impact of the pandemic in vulnerable population. So they've been providing us regularly with input. Initially, they were very interested as well in science communication. They're still very interested in science communication, but I think they're combining this with science policy, I think has been extremely helpful to us.
And maybe I could add a little bit here, Julia, that my group as well, they have a session right at 2:30 Montreal time, like in a half an hour session organized by the youth group that we have. They are just amazing. And they develop a kind of a protocol. They call it Conquer. So basically for youth, for student, for advisor, for chair of department, for president of university, for government advisor, to basically sign on the dotted line saying, yes, I will be willing to do this, and that. So very, very active, very dynamic, and it's always very refreshing to talk to them. And often they bring a perspective that, yes, you knew, but did not really thought about that much. So I think it's beneficial to everyone to have these guys and gal around us. Very, very positive.
Can I make just one quick comment? I think this is brilliant. And I think my comment is that just last week, I asked my team to look at what you've been doing, Mona, with the CSA Youth Council and to copy it shamelessly.
Good. Good. And I think Mona kind of copied a little bit what we had done in Quebec first. So that's good. And there is no copyright, so you can all copy it. And there'll be...
Well, isn't copying the best form of flattery?
That's true. Thank you very much. So I think there is still a lot of questions from the participant, from the audience, but we're running out of time now. So thank you very much to all of you. I will not try to summarize everything that we have discussed, but I think one key aspect is lesson learned. Of course, we're not finished yet with that pandemic. But we have to make sure that we just don't go back to the old shoes in a few months or a week time, so that we all learn, and together, talking to each other, we try to develop ways so that would be better prepared for the next one. Because we have friends and good scientists here in Canada, and some of them are telling us, well, COVID is not that much, not that pathogen, it's just kind of pathogen which is not that aggressive, probably much worse to come. So we have to be much better prepared and probably have more activities at the global level on that, so that we have a signal. We can signal pandemic or beginning of pandemic much earlier on. And so certainly that's something that if you are interested with the INGSA network, the International Network for Government Science Advice, the next meeting will be in Montreal. It was supposed to be this year, but will be in the fall of 21. So that's something that we could discuss at length during that meeting. And also another aspect very, very important for us all, I think. How can we apply some of the thing that we learn with this pandemic to other challenge of our society? And we discussed a little bit about climate change, and maybe others like all with the SDG. So is there ways to learn from this pandemic to apply that to other major challenge related to sustainable development? I think with that we'll close, and we'll thank you all for your participation. Thanks also all the participants. I think at the top of it, probably close to 400 participants, and some of them had trouble with the link, not surprising. But we'll also ask all the participants to fill up the survey, the form that CSPC has on its site, so that what you like about this session, what you did not like about the session, and how can we do better next year, hopefully in person and somewhere in Canada. Thank you very much to you all. See you.
Thank you very, very much.
Thank you. Bye-bye.
Merci beaucoup. Au plaisir.
Bye-bye.